The cost of healthcare in this country remains unaffordable to many people. And this is evident going by the number of WhatsApp groups you'll find yourself in to cater for medical bills, begging the question, just what will it take to fix this sector?
Our dream and our desire is that every individual of society should have an insurance cover. Today, it tends to be the preserve of the well-off who can afford a private insurance cover, or the preserve of those in corporate who their employer can afford to insure them. Our dream then, as Jubilee, and our focus is to provide access to affordable and quality healthcare, and we do that through quite a number of initiatives. We do work with other private sector players, we engage with government, and we work with all other stakeholders. We go further to speak to the doctors, a large number of the stakeholders we work with, and say, how do we bring this cost down? How do we bring the cost of drugs down? How do we bring down the cost of care? There are always ongoing discussions, and there are always ongoing conversations that will go on in this area. For us as Jubilee, what we do is say, what does the customer need? Is it about the cost? Can they afford it at a different level? Is it about the price? And we say, what is the lowest price point? And we even go a step further and say, can we break it down so that it's a bit more bite-sized, and say, do you want to pay, over 4 or 5 months then to make it a lot more affordable? As it is often said, we are all just one hospital bill away from poverty. And often we don't realize it's not just our own hospital bills. It's our sisters, our brothers, our parents, our friends. And therefore why health insurance is at the center of our very existence as society.
There is the informal market. Now, the informal guys are typically richer than the formal ones. It's just that they don't have a payslip and they don't wear a tie like me and you. And that guy doesn't have health insurance. Can he afford? Of course, yes. Now, what is the missing link? Somebody to explain, to convince, and then demonstrate that it can happen. So we must then present a face of credibility and convince that informal segment that insurance truly pays.